Doctor, I am confused. I want to know more about family planning.
Okay, I will help you. Family planning, literally, contraception, can be used to plan when women and couples have children and how many children they want to have. This includes choosing when they want to begin having children, how far apart they want their children to be, when they want to stop having children. Contraception lets women and couples have the number of children they want, when they want them. This is everybody's right under the United Nations Declaration of Human Rights. Delaying or spacing babies allows women and men to follow education and career goals that may be interrupted by having children. This empowers people and increases their ability to earn more. With fewer children, families are also able to invest more in each child. Reducing pregnancy-related risk. Girls and young women are especially at risk of problems in pregnancy. Contraception allows them to put off having children until their bodies are fully able to support a pregnancy. It can also prevent pregnancy for older women who face pregnancy-related risks. Contraceptive use reduces the need for abortion by preventing unwanted pregnancies. It therefore reduces cases of unsafe abortion, one of the leading causes of maternal death worldwide.
Now I understand. Please tell me more.
Healthy babies. Pregnancies that are too close together or poorly timed contribute to high infant mortality rates, that is, the rate of babies that die within their first year of life. Contraceptive use lets women plan their pregnancies so they can make sure the baby is getting the best care before and after birth. In the 1950s, before reliable contraception such as the pill was available, New Zealand had an infant mortality rate of 26.30 infant deaths per 1,000 births. In 2012 that rate was 4.2. Lower than the United States, but higher than a number of other developed countries. Better health care and hygiene, as well as the use of modern contraceptive methods, have contributed to this great improvement.
So, Doc, what are the various types of birth controls?
Birth control methods can be broadly classified into barrier methods that prevent sperm cells from reaching the egg, methods that prevent ovulation such as the birth control pill, and methods that allow fertilization of the egg, but prevent implantation of the fertilized egg inside the uterus womb, such as the IUD intrauterine device. Condoms and diaphragms are examples of barrier birth control methods. Birth control pills are an example of the hormonal birth control method that prevents ovulation. The decision about what kind of birth control option to use is extremely personal, and there is no single choice that is safest or best for all women or couples. A woman should carefully weigh the risks and benefits, along with the effectiveness of each method before choosing a birth control method. A thorough and open discussion with a healthcare professional can help in this decision process. Different forms of birth control have different side effects and risk profiles. The choice of birth control method depends on many factors, such as the desire for reversible birth control, preserving future fertility, or permanent birth control methods, surgical sterilization. Some birth control methods, such as barrier methods, may offer some protection against sexually transmitted diseases, STDs, while most methods do not. No method of birth control is 100% effective in preventing STDs. Some birth control methods have higher effectiveness rates than others, but no method of birth control is 100% effective in every case. Birth control works to prevent pregnancy in different ways. Hormonal birth control methods work by preventing ovulation, so that a woman is temporarily infertile. Barrier methods of birth control prevents the man's sperm from reaching an egg. Barrier methods include diaphragms, condoms, and cervical caps. Spermicide is a chemical that destroys sperm to prevent them from reaching the egg. Birth control methods such as intrauterine devices work by preventing a fertilized egg from implanting in the uterus and causing a pregnancy. Can you get pregnant on birth control? There is no form of birth control that is 100% effective, so it is possible to get pregnant while using most types of birth control. However, many types of birth control, when used correctly, are highly effective in preventing pregnancy. For example, the birth control pill is over 99% effective in preventing pregnancy when taken correctly. For all forms of birth control, it is important to have a basic understanding how they work and how to use them correctly. Types of birth control methods include options that prevent sperm from reaching an egg, known as barrier methods, methods that prevent ovulation, and methods that prevent implantation of a fertilized egg into the uterus. Permanent methods, surgical sterilization, are also available for those who no longer desire to have children. Types of birth control include hormonal birth control methods include birth control pills, hormonal patches, birth control implants, vaginal ring barrier. Birth control methods include diaphragms. I want to go for lunch. I will continue tomorrow. Stay tuned to this channel and subscribe.